Now, how do you diagnose what is the underlying pathology leading towards this unconsciousness or the prevailing unconsciousness or vegetative state in the individual? Because until and unless you know the underlying pathology, the treatment guidelines would not be modulated in a proper way. So knowing that and diagnosing that is very important at this state. Laboratory studies or the lab investigations that you're going to call for or ask for are the analysis of blood and urine. CSF analysis very critical. Arterial blood gases or ABGs are done immediately. You ask or order for renal and hepatic functions as soon as possible. Toxicological analysis. Just to rule out any drug abuse or use of any illicit drugs is also done as urgently as possible in these patients. We move on towards the radio imaging techniques such as CT scans and MRIs, because when you want to evaluate, for instance, even in case of the patient that we were discussing, we wanted to know whether there is some sort of a hematoma or the hemorrhage that the patient can be suffering from. And obviously that is resulting in that particular clinical picture that we're dealing in with. So you would ask for these CT scans and MRIs to be performed on the spot, and obviously you're also ruling out any kind of mass herniations or midline shifts that are present in the patient. You're going to also look for any abnormalities in the EEG patterns as well, because that is going to reveal a lot of metabolic disturbances for any patient, even if he or she comes up to you in the ER departments with a history of trauma. Certainly, you're going to rule out all the other causes that are contributing towards the comatose condition, any kind of prevailing factors, drugs, or even the metabolic disturbances that the patient can suffer from. So you're going to rule out all of these causative factors and just focus on the particular factor that is contributing, or the major factor that is contributing towards the comatose condition in the individual, and then carry on with the management guidelines or the treatment protocols that you're going to perform for the patient.